Hi, I'm Dr. Todd Shatkin. On my next patient, we're going to be converting a full upper denture to a fixed roundhouse. He had a full denture with 6 mini implants. Come on over here and I'll show you on the upper. And it works pretty well, but we also did a full roundhouse lower, and he likes his lower permanent teeth. So we're going to convert the upper denture to a fixed roundhouse bridge. So we've already made the upper roundhouse bridge to fit over the 6 existing implants. We're going to be adding 4 additional implants. Bite together for me. So we're going to be adding 4 additional implants, open for me, in the posterior where these open areas are in the bridge. So I've already anesthetized him, and we're going to go ahead and place those 4 implants. I'm going to mark the area where I plan to place those implants. And because the bridge was made with a trough in it, I have plenty of leeway. So I'm going to go ahead and place 2 here and 2 over here. And that should line up pretty close to where the areas are in the bridge. Let me just confirm that. Yep. And we're also going to be doing a sinus lift on this procedure. So we'll show you the use of the sinus lift technique that I developed in the last year with the Shatkin Sinus Lift Kit. This way. This is the Shatkin Sinus Lift Kit. And we're going to lift the sinus membrane about 2 to 3 millimeters on each implant. So we're going to go ahead and make our first pilot hole. And our next pilot hole. We're only drilling about 3 to 4 millimeters because the sinus is at about 8 millimeters. So we're going to use 11 millimeter implants. So Chuck, come over here, I'm going to show you this. We're going to use the 11 millimeter stopper on the 1.6 millimeter bone expander. It says 11 on there. Now you can place this by hand or you can do it with a driver. So I'm going to use the contra-angle driver. And I'm going to go ahead and use the bone expander. So you see we're using a contra-angle driver with a bone expander. And I'm going to expand the bone at that 11 millimeter length and push that bone right up into the elevated sinus. So here we are. You getting a good view of that? Absolutely. We're going to go until that brass stopper just touches the soft tissue. As soon as that touches the soft tissue, we're going to back it up. So right about there. Now we're going to back it up, reverse it. And we just tented the membrane because the end of this instrument is blunted, it's not pointed. And we're going to do the same thing on the next one. And we're going to reverse it. Simple as that. Next, we're going to go ahead and take our 11mm implants and place the implants. And what that bone expander does is not only does it lift the sinus, it also densifies and compacts the bone to make it more dense around the implant. That's why we got nice, good bony resistance. I'll go ahead and do the next one. Again, good bony resistance with that beeping sound over 30 Newton centimeters of torque. I'm going to go ahead and try the bridge on and make sure it still fits over those implants, which it does. Bite together. Perfect. Okay, open. We're going to do the exact same thing on the other side now. So we just performed 2 sinus lifts on the right side and placed 2 implants, 11 by 2.5, and we really only had about 8 millimeters of bone. And I'll show you the x-ray when we're done. We can come back here if it's easier for you. I can do this. Okay. We're going to again do an 11mm sinus lift. You just press the yellow button on the foot pedal to reverse it. On the Todd Shatkin motor. We're going to do the second hole now. Lifting the sinus membrane about 3 millimeters at each location and compacting the bone. You're not having any discomfort, are you, sir? Good. Good. Next one. Again, we got 30 Newton centimeters of torque there right at the end. We go to place our next one. Okay, they're all solid implants. We'll try the bridge back on. And bite together. Looks beautiful. Open. So we're going to go ahead and cement this bridge for Mark. He had his wife look at him. She approved of everything. And we're going to go ahead and place this permanent bridge in his mouth. Will you dry the implants, please? We're using the Shatkin First Resin Cement. Bite together. And just hold that just like that for 5 minutes, okay?
Yeah.
Don't open, okay? So we've completed placement of 4 mini implants. We've performed 4 sinus lift procedures, and we've cemented his upper roundhouse bridge in less than 20 minutes. Thank you for paying attention to the program.